Good afternoon, and thank you all for joining us today. Again, my name is Teresa Miller, and I have the privilege of serving as the Secretary of the Pennsylvania Department of Human Services. And today I'm honored to be joined by Dr. Meredith Matone, who's the Scientific Director of PolicyLab at Children's Hospital of Philadelphia, and the lead investigator on our collaboration to complete a new family support needs assessment. PolicyLab worked with our Office of Child Development and Early Learning, or what we call OCDEL, to produce a statewide report on Pennsylvania's maternal, young child, and family health, and to assess the capacity and scope of home visitation services. The clarity that the Family Support Needs Assessment provides is something not always available to policymakers and lawmakers. And that's why I'm so grateful to OCDEL and our partners at Children's Hospital of Philadelphia for their commitment to this project. Policymakers should not make decisions without understanding real needs to better inform allocation of resources. The Family Support Needs Assessment gives us the opportunity to monitor progress made through investments and opportunities to better support children and families across Pennsylvania. Crucially, this report gives us a county-level look at the needs of Pennsylvania families. To be very blunt, Pennsylvania is a big state, and almost 13 million people live within its borders. And beyond that large scope, our Commonwealth, as we all know, is not a monolith. And policymakers need to make decisions that acknowledge the fact that life is different for people across our 67 counties. The needs of people in Erie are not necessarily the same as the needs of people in Philadelphia or in Adams County. We need to be allocating resources in a way that makes the most sense for the people receiving those resources. OCDEL is the lead agency administering the Maternal, Infant, and Child Development Early Childhood Home Visiting, or MCV, program in Pennsylvania. The federal program provides funding for voluntary, evidence-based home visiting services for at-risk pregnant people and parents with young children up to kindergarten entry. In Pennsylvania, this federal funding currently supports 4 evidence-based home visiting programs across the state: Early Head Start, Healthy Families America, Nurse Family Partnership, and Parents as Teachers. Part of our responsibility as administrators of this federal funding is the completion of a statewide family needs assessment every 5 years. And there's some very good news contained within this latest report. Dr. Matone is going to share the report's findings with you in more depth, but I just want to highlight a few key points first. Since the 2014 statewide needs assessment, many of Pennsylvania's 67 counties have seen substantive improvement on important metrics. For example, nearly every county, 63 of them, saw improved rates of preterm birth and teen births. 60% of counties, or 40, saw improvements in infant mortality rates. And half of counties, or 32, saw a reduction in the percentage of children under the age of 5 living in poverty. This is a very large report, so I don't expect any of you to read the whole thing today, but please look for the county profiles that contain your coverage areas. For each of the 6 domains studied, which are socioeconomic status, maternal and child health, substance use, community environment, child care, and child safety and maltreatment, each county was measured and assessed as low need, moderate need, or elevated need. You'll also find some community spotlights in the report highlighting county-level programs and services that support families. For example, in rural Tioga County, there's a Tioga Targeted Transportation Program that helps residents without personal transportation access medical appointments, court dates, probation appointments, substance treatment programs, support groups, and parental visitation. In Northumberland County, the county's Department of Children and Youth and the Agency on Aging are addressing intergenerational family needs with a support group and reimbursement program for grandparents raising grandchildren. And in Allegheny County, there's a pediatric bilingual clinic called Salud para Niños, or Health for the Children, that's offering free and culturally sensitive care designed to meet the needs of the community's Spanish-speaking and Portuguese-speaking families. Good things are happening across Pennsylvania, but of course, there's still much work to be done. Please use this report as a reference in your reporting going forward, especially as we continue to face a period of uncertainty. As I said earlier, we need to be allocating resources in a way that makes the most sense for the people receiving services. And when conditions change, we need to change too. We know that the COVID-19 pandemic has created challenging circumstances for families, and their needs may be further exacerbated. Data collected through this assessment will be a valuable roadmap as we help the Commonwealth and its families recover and move forward. And at this time, I am very pleased to introduce Dr. Meredith Matone.
Thank you so much, Secretary Miller. Thank you for the great introduction and overview of this report. I am really, really proud to be here today on behalf of our partnership with Octal and on behalf of the home visiting research team at PolicyLab to give a little bit more of an overview of the findings of our needs assessment and talk through the structure of what's going to be in the report, what you'll find in the report. So I'm going to share my screen here so that I can walk through with you some of the findings. And so just by way of background on what needs assessments are and their purpose. So needs assessments are really a foundational public health tool for understanding community level needs, strengths, and service capacity. And these really are a systematic assessment of a defined regional area or geographic area. And they often accompany program requirements for federal or community-based programs. And as you heard Secretary Miller share, the primary purpose of needs assessments are really twofold. One, to inform allocation of resources, and two, for education. And so today we're going to be talking about the needs assessment that was conducted as a part of the Maternal, Infant, and Early Childhood Home Visiting Program, or MCV for short. And I can skip over a little bit of the MCV overview because Secretary Miller really shared that the purpose of this program is to serve as a family support program for families in Pennsylvania who are pregnant or parenting infants and young children, with a particular focus on families who are living in under-resourced communities. This program is authorized under the Affordable Care Act, and Pennsylvania has been administering through Octal the MCV program for about a decade now. And during this time, we've seen a lot of growth in home visiting services in the Commonwealth, which we can talk a little bit more about. But as a requirement of MCV, there is a periodic needs assessment that is to be conducted to inform allocation of home visiting resources to the communities most in need. And so the approach that we took for conducting the 2020 needs assessment, I think, was fairly unique and innovative. We decided together with Octal to really use a multi-method approach that prioritized a strengths-based framework and also prioritized community voice. And so we used three different sources of data to inform this needs assessment. The first was the use of administrative data. And we used administrative data from a variety of resources at the state. So everything from birth certificates to data from the Pennsylvania Department of Transportation, the Pennsylvania Cost Containment Council, to really get those baseline metrics that we use to assess community needs and benchmarks across the Commonwealth. We also relied on publicly available survey and administrative data. So for example, the National Survey of Drug Use and Health. We paired that data with two other data sources. So the first is surveys. And so we rolled out a community survey across the Commonwealth to really hear from stakeholders within communities their perception of the accessibility, availability, and quality of health and social services across the Commonwealth. And we were very pleased. We have representation from community members from every county in the Commonwealth and over 2,000 respondents to this survey. The last data source was interviews and site observations that we did with program administrators of Octal's family support programs and other local programs serving families on the ground level in counties. I do want to make a note that the data that we collected, we really wrapped up data collection as the pandemic was beginning. And so our data represents sort of a reflection of the Commonwealth just prior to COVID. And I think it'll be important to continue to monitor. Certainly, we understand that the needs of communities are likely exacerbated during this time. And so each county we reviewed across 6 domains, which Secretary Miller shared with you, and you can see reflected here. And we used 60 different data indicators in total across each of these 6 domains. And you can see some examples of these indicators here. So for example, in the socioeconomic status domain, example indicators are renters who are cost burden or WIC redemptions per capita. In the community environment domain, we looked at libraries per capita, elevated child blood lead levels, maternal and child health, preterm birth, infant mortality. And we ranked each county as low, moderate, or elevated need within each of these 6 domains. And in essence, counties were ranked among one another using a quartile methodology. And we did that so that the reflection was focused on the state itself as a benchmark. So this was a very Pennsylvania-specific ranking scheme. These domains were chosen because they really reflect factors that influence the health of communities and families either very directly or indirectly because they influence access to services or exposures to other health harms. We made the decision together with OCDEL to look at 60 indicators in order to really have a comprehensive view of community well-being. This was really critical to us in our sort of goal to have a very strengths-based needs assessment, because we know that a limited set of indicators would give us very little insight into areas where communities may have strengths in which we can build upon. So for example, if we just look at the benchmark of child poverty within a county, it may mask that a community has high access to WIC, has high access to libraries or other services that may serve as protective factors for families and be avenues for increased service delivery within a community. At the same time, we also know that a comprehensive view allows us to see areas that may be hidden to us traditionally. So for example, if we were just looking at a county's confirmed rate of child maltreatment, it may not put into view that rates of violence against women may be elevated in that community. And so if we had a goal of improving child and family safety in that particular community, we may want to focus resource allocation to domestic violence prevention. And so to start with the findings, and I'm so happy that Secretary Miller sort of spilled the beans on some of these incredible strengths. I think we were very pleased to find that there's so much to commend in Pennsylvania right now. And so in starting with these strengths, since 2014, as you heard, nearly every county saw improved rates of preterm birth and reductions in the rate of teen births. 60% of counties saw improvements in infant mortality rates. This is very important at a time when the national context on birth outcomes is really moving in the wrong direction. We saw that nearly half of counties saw a reduction in childhood poverty. These are really, really big and important benchmarks of health and well-being of children and families in the Commonwealth. And so this is a big deal and should really be applauded. We also saw that Pennsylvanians, on the whole, have more access to libraries, stores that accept supplemental nutrition assistance program, and lower crime rates compared to national state averages. And importantly, in our community survey, we saw that half of community members surveyed perceived favorably both the availability and quality of health and social services for families in their county. And so if we transition on to needs, what I'd like to share with you today are sort of the high-level needs. And Pennsylvania communities, what we found is are experiencing pronounced needs related to mental health, substance use, economic conditions, and intimate partner violence. And really, these 4 themes were noted across all 3 of those data sources that we looked at. And so we saw it in our benchmark data when we looked at our administrative data. So, for example, in rates of diagnosed maternal mental illness. We then heard it in community voice in our survey. These were themes that came out in our community survey. And we also heard in our interviews with program administrators of family support programs from their lens of working with families that these were priority issues. And so triangulated across all 3 data sources, these were the needs that were elevated as pronounced. These were needs that were shared across urban and rural communities in the Commonwealth. So I wanted to take a minute to note that Octal really showed tremendous leadership in asking to include a look at racial disparities and issues of racial disparities that may be impacting families in the Commonwealth. And so we were able to include 2 metrics to assess racial disparities as a part of that set of 60 indicators that we looked at. And what we found is that Pennsylvania, like the nation, has an opportunity to address racial disparities for families. We did identify the presence of structural and birth outcome inequities for Black infants and Black families in both urban and rural communities in Pennsylvania. The last thing that I'd like to share is that when we look at the report and we try and identify where there may be counties with concentrations of need, we did identify 15 counties, so a fifth of the counties in the Commonwealth, that met elevated need thresholds for at least 3 of the 6 domain areas that we looked at. What's important, though, is that we weren't able to identify really any geographic patterns to where concentrations of need were in the state. So this report did not find that rural communities on the whole are doing worse than urban communities, for example, or that the western part of the Commonwealth is worse or better off than the southeast PA, for example. The fact that we weren't able to identify geographic patterns, I think, really underscores that each county in the Commonwealth has a unique profile of strengths and needs. And I think one of the things that's very unique about this report is the fact that we took such a comprehensive view allowed us to see in a very nuanced way both the strengths and opportunities and areas of resilience for counties across the Commonwealth. And so now what I'd like to do is share with you a little bit of what you'll see, the components of the report when you look through it, which I hope that you will. So as Secretary Miller mentioned, each of the 67 counties has a county profile. And the county profile is really just a 1-page summary that provides a little bit of information about the demographics, the numbers of families living in the county, and the results of the identification of low, moderate, or elevated need across each of these 6 areas, and then provides an overview of where the county stands in terms of its capacity for home visiting service delivery presently. And so here you'll see an example from Northampton County, and I sort of called out as an example of the text that you'll see for one of the domain areas. So here is socioeconomic status. And Northampton County was found to have low need relative to the rest of the Commonwealth on the domain of socioeconomic status. It had moderate to low levels of socioeconomic need and poverty. However, there was an opportunity for additional supports to reduce rent burden. And so what we tried to do is really, in a very nuanced way, provide sort of a snapshot of our entire assessment across all 60 indicators in a very digestible way in these county profiles. What we also found in terms of home visiting in Northampton is that Northampton is administering 2 evidence-based home visiting programs and serving about 200 families, which represents about 3% of the eligible families in the county. The report also walks through each of these 6 domains in detail. So every county has the data presented for every indicator for each domain. And then we present sort of an aggregate map where you can see how things shook out in terms of low, moderate, and elevated need for each one of the 6 domain areas. And so I pulled an example here for the community environment need. What you can see, or how to interpret this, is that areas of low, moderate, and elevated need really dispersed across the Commonwealth. We had equitable numbers of counties with low need, as we did counties with elevated need on community environment indicators in the Commonwealth. And very positively, there were 2 counties that we found that did not meet elevated need thresholds for any one single indicator within the community environment domain. This is an example of the community spotlight, and you heard Secretary Miller talk about Tioga targeted transportation. One of the things I think our team in Ocdel is most proud about in this report was the inclusion of these community spotlights. So for each of the 6 domains, we highlight a community program that is responding in an innovative or otherwise important way to supporting families related to this domain. And these programs were reported and endorsed by community members as part of the community survey. So these were sort of crowdsourced in a sense, if you will. These weren't things that either PolicyLab or Ocdel identified as wanting to highlight. These came from communities as community members reporting important programs to them or the families they serve within the community. And so here, since I showed the community environment domain in the previous slide, Tioga Targeted Transportation is the community spotlight that corresponds with that domain. And this is a terrific program. And what we did for each of these programs is we did a very structured interview with the program administrator for each of these programs to learn all about the program, how it operates, its history, who it serves, and then also present some lessons learned with the hope that if there are other communities struggling with similar issues, that they might have a path forward or get some ideas about how to implement or enhance some of their existing services within their communities. There's also within the appendix, because we got a couple hundred suggestions for programs. So within the appendix, we list out all of the programs that were sort of crowdsourced in the community survey as being innovative programs. And so lastly, in terms of data, review what we found in terms of our home visiting capacity. So we found significant increases in statewide investment in evidence-based home visiting programs in the Commonwealth. So about 5,200 families were served by evidence-based home visiting in fiscal year 2016-2017. At present, we have more than 8,200 families being served. This is almost exponential increase in the number of Pennsylvania families receiving these wonderful services. We do see that home visiting system in the Commonwealth serves approximately 5% of the total eligible population across the state. And I do want to point out that this number really is fairly nationally generalizable. We know that as a nation, as wonderful as home visiting programs are, we haven't yet built the infrastructure to serve all of the eligible families. So in 2018, as an example, there were 18 million eligible families for services across the country that were not yet receiving home visiting services. Just wanted to share that to put this 5% in context. We also identified some really notable and important strengths of the home visiting service infrastructure in the Commonwealth. The first is that the workforce of home visitors, by and large, reflects the community, as reported to us by program administrators. And this is really important for a program like home visiting that is really unique in that it is built on sort of a trusting long-term relationship between a home visitor and a family. So the intent of a home visiting model is to really build a long-standing relationship. So families work with a home visitor for 1, 2, or even 3 years. And so the importance of identifying and supporting a workforce that understands and comes from the community really can't be understated. And so the fact that we heard that reflected back to us by program administrators was very encouraging. And in a similar way, we also heard from several program administrators that they prioritize the availability of translation services to improve accessibility of home visiting services to Pennsylvania's immigrant and refugee community. And the last thing that I wanted to highlight, which is really a strength and innovation within Pennsylvania's home visiting infrastructure, is targeted engagement of families with substance use challenges. So OCDEL has supported a pilot program for home visiting sites across the Commonwealth to really improve, enhance, and innovate their service delivery to provide better engagement and coordination of social services for families impacted by substance use disorders. And what you'll find as part of an appendix to this report is an overview of an evaluation of the implementation of these pilot programs across the Commonwealth. And so with that, just as to wrap us up, what we have in this report is really a robust and hyper-local look at counties across the Commonwealth and how they're faring both from a strengths and opportunities perspective. This needs assessment is both a tool for making really smart policy and funding decisions, as well as education. And lastly, just to reiterate that, the context that we're in with COVID and the fact that it'll be important to continue to monitor these metrics to see where community strengths may be challenged or where we may want to leverage community strengths to better support families in this time of COVID. So with that, I'm going to turn it back over to Erin.
Thank you, Dr. Matone. That was great. I appreciate that. All right, so at this time, I'm going to go down the list of reporters who RSVP'd and see if anybody has a question. When I call the outlet that you're with, just go ahead and take yourself off of mute and ask your question. And I'll try to make sure I give everyone a second chance in case you don't get to the mute button fast enough, which happens. All right, so first up is CBS 3. All right, how about Radio PA? Fox 29. The Associated Press. CNN. Public Source.
Thanks, Erin, for taking my question. I noticed just doing a search and flying through the document really quickly that 5 of the 6 indicators in Allegheny County are moderate. I'm wondering what the takeaway from that would be for our readers. And then 2, as a follow-up that's related obviously to COVID, is how much would COVID aggravate these findings?
Dr. Matone, can you take those?
Sure. So thank you for the question. So what I would say is that in terms of Allegheny County, the finding that 5 of the 6 of the domains were moderate would really suggest that Allegheny is faring on par with the state as a whole. So on average, Allegheny is really faring comparably to the state averages in each of those domains. I think what that may suggest from a program perspective is that there are opportunities to dig in a little deeper. And what I might encourage you to do, and what I apologize I neglected to mention, is that given that we know that many of the counties in the Commonwealth are very heterogeneous, even within county, we identified 12 counties to do a zip code level analysis for. And we identified these in priority with OCDEL And Allegheny is one of those counties. So what I would encourage you to do is take a look at the zip code level analysis, which is in sort of the full body of the report. And what you can see is that within the county of Allegheny, we do see heterogeneity across several of our indicators, across the sort of eastern, western, and northern part of the county in that zip code level analysis. So I think sometimes in our larger county, moderate may mask some of the within county heterogeneity, and that's certainly the case for Allegheny. And I think we were able to capture some good information to inform your readers about where there may be some sort of hot-spotted areas of both need and then areas of the county that are doing really particularly well on some of the indicators.
And just real quick, if I, hopefully not hogging the mic here, but does the report indicate which of the 12 counties you did the zip code analysis for?
It does, yes. And it goes over our methods for how we selected them, which was basically we sort of looked at, we selected an indicator and identified the counties that had sort of the highest proportion of zip codes that both had low need and elevated need within a particular county. So indicating where there was counties where there was really a lot of diversity on a particular metric. And then we prioritize that with Octal, knowing that they have a lot of experience making programming decisions and have a really nuanced understanding of the diversity of the service landscape that might exist within certain counties.
Nicole, do you want to ask your second question again? I know it was related to COVID, but
Yes, thank you, Erin, for noticing that. Yeah, and then the reason we're small but ambitious, and really focused on COVID and how it is impacting really everything in our lives. But how would this report findings be aggravated in any one county by COVID? Because
I don't know if it was just me, but Nicole, you cut out right at the end there.
I think I got the gist.
Okay.
I'm happy to take a stab, and Nicole, please let me know if this is not answering your question, but I think it's a really relevant question. And so the short answer is that until we have the data, we don't know exactly. What we did include was a preface related to COVID, where we mapped out sort of early warning sign data that we do have at this time in terms of increases in utilization of some public services, and mapped out what we see as PolicyLab, who has a mission towards having an eye towards children's policy issues and public systems, where those sort of priority areas are that we're going to want to monitor children and families moving forward. And so we sketch that out in a preface for how you might interpret what the likely changes to family needs or exacerbations of family needs are going to be now that we're in this time.
Thank you. Nicole, does that answer your question?
I'll refer to the port for that. Thank you for taking my questions.
Great, thanks. All right, how about KYW News Radio? PLS? WESA? Do I hear somebody? No, okay. How about WBNG? Spotlight PA? The Sentinel?
Yeah, can you hear me, Erin?
Yep, go ahead, Zach.
Yeah, I was just wondering, I was looking at the breakdown for Cumberland County, and one of the moderate need items was childcare. How much of that need or the lack of childcare is something that can be addressed through Department of Human Services programs and things like that, and how much is an issue with funding of public school districts here? We're talking about childcare. What kind of, I guess, how do we get to fixing the issue from a financial or legislative standpoint?
Good question. Dr. Matone, I don't know if you have any direct thoughts on that, but I do have some folks from Octal on the line as well. So I'm going to let y'all fight over it. And I'll open it up. I don't know if Secretary Miller, if you want to maybe defer to Tracy on this one, since we're talking very specific to Cumberland.
I would. I think Trace might have some thoughts on that. Thanks.
Okay, so, you good, Trace?
Sure. So one of the things I would just remind folks about childcare is structurally as a whole, childcare is a small business, whether it's operated for profit or as a not for profit. And so, many of the resources that are coming into childcare capacity that's supported by a family's private pay tuition and need in specific communities. Coupled with that is the public support and program, and that's childcare. And so those two things cobbled together are the funding mechanisms that support childcare. So there has to be an interest by a provider to serve a specific community, and then the capacity for families needing care that are amalgamated in a specific area to access childcare. So in terms of, the various needs versus availability of capacity, going to vary from community to community, and childcare remains open based on what the community is able to support. So it's a complex answer to your question, and I don't know if I quite got it, but I'm hoping I gave you a little bit of background information for it.
Zach, do you have any follow-up questions there?
No, that's fine.
Okay, thank you. All right, how about the last one on my list is KDKA radio. All right, is there anybody that I missed? How about anybody who I called but thought of a question since then? All right, last call for follow-up questions. Anything? All right, wonderful. Thank you so much, everyone, for joining us. Thank you to Dr. Matone and everyone at PolicyLab who helped out with this. Thank you, Tracy, for helping us out, and thank you, Secretary Miller. Anyone who has questions, please feel free to contact the DHS press office. The report is online. The link to the report is in the advisory, it's in the press release, and I put it in the chat function as well. Continue to drill down into that and let us know if you have any questions as you get a chance to look at your coverage areas. We're happy to set up other times to talk to folks or ask questions. So thank you again. Have a wonderful day. We'll send out the recording later.
Thank you. Thanks, Erin.